Good afternoon, good morning. I hope you are well. Just as a moment of introduction, my name is Jamila Hassan Jones, and I am a registered nurse by background. I have been in the healthcare field ooh, since before 2000, so let's just leave it there. It's been about 25 to 30 years, and I have served in multiple roles. I generally say that I am that nurse that has gone from the bedside to the boardroom. I have had the pleasure and the privilege of not only seeing hospitals to their greatest rises when they meet certain criteria to win great awards that speak to patient safety, but I've also had the pleasure of working with organizations who have been in bad situations related to maybe patient outcomes and how things haven't gone so well. So, why do I tell you all that? I tell you all that just to kind of tell you a little bit about where I've been professionally. But where am I personally? Well, I am a 51-year-old woman who has the pleasure of having a 14-year-old daughter and a 25-year-old son. Um, and the cool part about that is you get to see things from both perspectives. I'm a mom, I'm a wife, I am a daughter, I am a niece, I am a sister, I am a badass auntie, like all of those great things. Um, but I also find myself being a patient advocate. I find myself being a healthcare advocate. And last year, when my grandmother made her transition at 93, one of the last things she told me was, Jamila, you've taken care of me. Now go take care of somebody else. And so I've struggled with how do I do that? How do I make my education and my experience the most impactful? And I've decided that I'm going to do it the same way I did it for my grandmother. I am just going to adopt more people into my circle. And those people will become the people that I get the pleasure and the honor of working with. The ones who need some help when they go to the doctor's office, the ones who want to know what are the right questions to ask the doctor, the ones who want to know, I don't even get to go to the doctor anymore. Now I have this televisit. What exactly does that mean, and how do I get prepared for that? So I have developed what I consider to be a list of checklists, a checklist of sort. And these checklists help you um, go into your provider's office and ask the best questions. Ask those questions that are going to get you the answers and the results. And above all, they put you back in a seat of power. What I find sometimes, having watched healthcare, being in risk departments and different events, patients sometimes just don't even know what to ask. So, because you don't know what to ask, you don't know what questions you should be expecting answers to. I've seen it when I worked home health, and you would get discharged, or patients would get discharged from the hospital that same day, and they would be so confused. What do I do? Family members are trying to help out, but they don't know what was done or what to do. You call the doctor's office and he says, I wasn't the one who saw you in the hospital, so we're just going to have to wait until your follow up visit. You wait on your home health nurse to come, and she may not be there for 24 to 48 hours. In the meantime, you're confused and you're just hoping that you're doing the right thing. So this channel is going to be dedicated for those um, members of the community who want to learn from a patient's perspective, because I've been both the caregiver and I've been the patient. And trust me, I understand what it's like to be on both sides of the coin. And sometimes being able to communicate is all we have left. Sometimes asking that right question is all we have left. And so we're going to shift this dynamic. We're going to be our own advocate. And when you're not sure what question to ask, now you have somebody in your corner. just know that I'll be more than willing to help however I can in giving you the tools to be successful. Because the assumption is that our physicians know everything there is to need to know about us. Reality is we know more about ourselves than our physicians ever will. They are given a recipe book. And based off that recipe book, based off the symptoms that we tell them, they go to their recipe book and they trying to find the best thing that will suit us. We have to be the ones to give them the specific ingredients. We are the ingredients. Our symptoms are the ingredients. Our symptoms will lead them to helping us figure out the best way to manage us. But we have to be active participants in our care. Make no mistake about that. So, if you're somebody who's like me, who's always curious about health, I always want to know the why behind the what. What is it that you're asking me to do, but why? And then how am I going to feel after I do that? And then when are we going to discuss whether or not this worked? That's me. This would be that channel for you. If you're that person who's waiting on the physician to tell you everything to do and you're just going to follow him, this may not be the channel for you. If you're that person who wants to chase down every vitamin and every hack and how to do the crazy juicing and all of the other stuff, this may not be the channel for you. We will talk about juicing and we'll talk about nutrition, because healing ultimately comes down to nutrition. Regardless of the supplements, regardless of the pills, healing comes to nutrition, and that starts with what we're putting in our mouths and what we're putting in our minds. So this could be the channel for you. And if you're a person who's like me, and this is where I'm really going to tell you, I told you I was 51. Remember that movie, Desperately Seeking Susan? I don't think I ever really watched it. But anyway, the title came to me. This is me, tired of desperately seeking healthcare solutions. Tired of chasing every fad diet, tired of chasing every juice healing, tired of chasing every supplement. This is years and years of experience of seeing it, of helping people, whether it's been in home health or hospice or in the hospital or even in my own family, helping people. This is for you if you are that person who's looking for a best solution that you're willing to try for yourself, that you're willing to document for yourself, and if you're willing to create a care plan, as I like to call it. A care plan keeps us focused. This is the channel if you feel like you want to know the what you're asking me to do, why you're asking me to do it, and who is going to help me. That's it. All right. So, a little bit about me. That's done. We won't go through that every time. But today I want to talk about one of the things that I have decided to really focus on this year. Last year, my focus was on, when I turned 50, my focus was on really getting my mind right, getting my mental health around being 50, regaining some peace that I had lost serving in so many roles. This year, it's about recapturing that youth and the essence of being, right word would probably be vibrant. I, I just want to feel my absolute best. That's it. I want to feel good. I don't want to feel restricted in what I eat. I don't want to feel restricted in what I drink. I don't want to feel restricted in my thoughts, because I know that this is limitless. I know that I won't get it all done, but I do know that when I get it done, it's going to be fun, step by step. So this channel is a step for health, because we're going to take little steps to make big changes for health. So one of the steps that I decided to do this year was to focus on my blood glucose level. And somebody has already asked me, why your blood glucose level? Well, I'm not diabetic. Even when I made my doctor's appointment for this coming week, the lady on the phone, I was telling her, can I tell you what my goals are? And she was like, yeah, but I need to ask these questions. Okay, questions have been asked. Now let me tell you my goals. My goal is I want a provider to partner with me about my blood glucose. She said, are you having problems with it? Are you a diabetic? I'm not a diabetic. But I will tell you that going into hormone changes, going into hormone shifts, one of the most unrecognized things that we as women have, and as a community, whether it be a community of color, an economic community, one of the major health pieces that we are overlooking if you're not diabetic is the monitoring, the regular monitoring of your blood glucose levels. So why am I checking my blood sugar? Well, the number one reason that I'm checking my blood sugar is because the U.S. Prevention Services Task Force recommends that blood glucose screenings be completed for patients between the ages of 40 and 70, regardless of whether or not they're symptomatic, regardless of whether or not I have increased thirst, regardless of whether or not I feel like I have lost weight without trying, regardless of whether or not, I feel like I'm not metabolizing my sugar well. That's been recommended. And we know why glucose management is so important. So before you think, I don't have glucose, but my mama might have, or my granddaddy might have this, that's genetics. I'm talking about now, how is it going to show up on you? So, first thing is know your numbers. I went out this week. Well, I've got two things. I went out this week or last week and I bought myself a blood glucose machine. Ta-da! It's a Mateen blood glucose monitoring system. Now, why did I get this machine? Well, the first reason why I got it is because I want to know my numbers. And I want to know my numbers consistently. And I want to know my fasting glucose numbers. That's the first thing in the morning before I've had anything to eat or drink. Hopefully there's been 8 hours between the last time I had something to eat and this time I've had something to eat. Most people will tell you that you're not diabetic if your fasting glucose level is less than 100. The goal is to be between 60 and 100. And so if you're at 100, they're like, good, you're not glucose, you don't have diabetes. Well, I'm here to tell you that there have been studies that have been shown that the closer that you are to the number 99, it actually increases your risk for diabetes by as much as 300%. So the goal is that your blood glucose level, your fasting blood glucose level, is actually below like 80. So my goal is between 60 and 80 because increased blood sugar, fasting blood sugar, and overall blood sugar really leads to those things that cause significant damage. And blood glucose levels that are high, fasting blood glucose levels that are high, really signify that there's a mismatch between what your body is producing and what your body can absorb. So, what are some of the things that we're trying to avoid by monitoring our blood glucose levels? Well, we're trying to avoid inflammation. We're trying to avoid insulin resistance. We're trying to avoid type 2 diabetes. We're trying to avoid early onset Alzheimer's disease. We're trying to avoid increased risk for coronary artery disease. We're trying to avoid increased triglycerides. All of those things are contributed to increased glucose. There are a couple of other ones that were really important to me at a different stage in my life. Polycystic ovarian syndrome, directly linked to glucose management and control. Infertility can be directly linked to increased glucose and glucose control. Cancer, blood glucose levels can be contributed to not just the diagnosis of cancer, but how cancer is managed and treated and your outcomes. So I encourage you, if any of those things ring true to you or loved ones, basic thing, get a blood glucose machine. Get a blood glucose machine. This one I ordered off of Amazon. Why did I order it off Amazon? Well, because this machine had one thing that the one that I bought at my local store did not. It had the blood glucose control solution. Why is that important? So we already talked about what I'm doing. I'm monitoring my blood glucose level. Why? Because I want to make sure that my blood glucose levels are within the range that will keep me healthy. Not about losing weight. It's not about making sure that I'm not diabetic. Diabetes is just one little piece of what blood glucose actually does. It's about more than that. And increased rates for a long period of time that are unchecked, by the time you get the diagnosis of diabetes, it becomes much harder to reverse those symptoms that were set on long before the diagnosis of diabetes. So I'm not going to set myself up for that. I have a family history of diabetes, type 2 diabetes. Everybody doesn't need that diagnosis. At some point, you have to be willing to break the chain, and it's going to start with what I put in my mouth and how I think about it. So we've talked about the what I'm doing, the why I'm doing it, and now the how I'm doing it. So I'm doing it by checking my blood glucose first thing in the morning. And I've also decided that I'm going to wear a continuous glucose monitor, and I will talk more about that in a later series. But I chose this machine because it has a control. And why is that important? Because these machines are not ready to use straight off the shelf without the control. You have to read the manufacturer's instructions. One machine is not the same as every machine. They have the same principles, they have the same concepts, but it's important that you calibrate this machine with a solution that's a control solution in order to make sure that the numbers that you receive are correct. You do not want to be chasing a blood sugar or correcting a blood sugar or reporting to your physician blood sugar numbers that are inaccurate. You generally take medicines. People who are diabetic take medicines based off those numbers. If the machine is not correct, then you could either be underdosing yourself or overdosing yourself with your medicines. So I encourage you, if you walk away with nothing else from this video, if you buy a machine or if you're using a machine, test your machine first. Make sure that the machine that you get has control solutions. Make sure that when you use your strips, you date your strips on the day that they're open, because the bottle will tell you that within a certain number of days, those strips will no longer be good. Make sure that you close the lid on your strips tightly after each use. Make sure that each time you switch out a bottle of strips, that you calibrate your machine by using that control solution to the new strips. Those are the best tips that I can give you to make sure that all of your hard work and effort that you're doing to come up with a good blood sugar is actually paying off. So, to sum it up, check your blood sugar. It's okay to check it if you're not a diabetic, We're not doing this just for diabetes. We are doing this for our mental health. We're doing this for our overall health. And we are doing this to see how our body responds to the food that we eat. That's it. That's what we're trying to do. Food is a treatment, and we should treat it as such. It's an enjoyable treatment, but too much of anything could be harmful for us. So let's make sure that as we go into this next year, that we're taking care of ourselves the best way we can. Check your blood sugar at least once a day in the morning. Make sure you know what your numbers are. And make sure that your machine is supporting you in having a great outcome. Until next time, this is Jamila. I hope you take a wonderful step for health and have a fantastic day. Thank you. Bye.